Hello, we are Angie Galarza and me, Laura Domenech, and in this presentation we are going to talk about the article Clinical Effect of Virtual Reality to Relieve Anxiety During Impacted Mandibular Third Molar Extraction Under Local Anesthesia and other similar articles that we found to compare each other. We have divided the presentation in three parts: a short introduction, the explication of the article, and to finish, the conclusions we have reached.
Anxiety is defined as a psychological state that is present in an unpleasant way, associated with psychophysiological changes, which would be a manifestation of an intrapsychic content. Thus, we understand that anxiety is a multisystem response to a belief of threat or danger. This anxiety is an individual, subjective experience with interpersonal variability and that generates a serious impact on the daily life of those who suffer it. Dental anxiety has incidence rates ranging from 4 to 23%. Thus, we divide this dental anxiety into three components: cognitive, physiological, and motor. The cognitive effects could imply a negative interference with concentration, hypervigilance, and a certain inability to remember some events. Physiological aspects are associated with excessive activation of the autonomic nervous system, which normally leads to impaired or shortness of breath, perspiration, and palpitations. Finally, we have the motor component, which involves poorly adjusted and less adapted behaviors, which can range from avoidance to escape from the dental office. Readers of the article on which this work is based are aware of the problem of this anxiety, which has been conventionally managed with the use of inhalation, anesthesia, or tranquilizers, taking into account the physical effects which are not suitable for all patients. They propose to experiment with virtual reality to see if it can be useful in reducing anxiety. Virtual reality refers to all those scientific and engineering techniques and systems which are used to create a non-physical environment, but which works by stimulation perception, including the person's senses. Virtual reality basically consists of three elements: presence, autonomy, and interaction. This method has found a wide range of applications in various fields. For example, in medicine, virtual reality has been used not only against anxiety, but also in areas such as rehabilitations or medical education. In dentistry, studies have also been carried out in which virtual reality has been used for the training of preparing a ceramic crown using this virtual education system, in which it's concluded that this educational system is suitable for the preclinical course of dental practice. This improves the skills of the students. Subjects were patients examined in the Department of Oral and Maxillofacial Surgery of the Saga University Hospital for the extraction of the third molar with mandibular impact from April to November 2018. These were selected according to exclusion criteria, such that pregnant women, people with a history of epilepsy, heart disease, dementia, or some mental illness, with a similar conditions of claustrophobia, people with previous dental phobia treatment, or who have experienced severe wasting. In addition to the treatment lasting more than an hour, were excluded from the study. The select age was from 20 to 65 years. Were randomly divided into two groups. The first one that used virtual reality had 51 patients, and the group that didn't use virtual reality had 49 patients. To carry out the study, after the local infiltration anesthesia, the patients in the virtual reality group were equipped. Before performing the extractions, they underwent a virtual reality presentation for a short period and were asked to confirm that they were not uncomfortable disturbed. All extractions were performed by a single oral maxillofacial surgeon. The presentations given to the patients had considered that the patients could remove their heads to follow the image with their eyes. The scenes displayed on the screen were changed approximately every 3 minutes to prevent patients from getting bored with the image. Perform a subjective evaluation, the presence and severity of fear and anxiety before and after treatment were assessed using a questionnaire that includes a visual analog scale. Pain experience during treatment was also measured using a visual analogic scale. Anxiety was rated on a scale from 0 mm full relaxed to 100 mm most anxious state imaginable. The post-treatment questionnaire asked patients to assess their satisfaction using a 5-level Likert scale with 2 extractions performed during virtual reality. They were also asked to assess the degree to which fear and anxiety had been alleviated using a 5-point scale. For objective study evaluation, heart rate variability was measured and analyzed in 8 patients in the virtual reality group using accelerated plethysmography. These were measured twice, once before treatment and once 10 minutes after the start of the procedure. Results in both the subjective and objective tests of anxiety, fear and pain, it was found that all of these had decreased considerably in the group of those who used virtual reality. On the other hand, in the group of those who didn't use virtual reality, anxiety increased.
Through the questionnaires carried out, we see that the majority of patients suffer from dental anxiety before undergoing any invasive procedure, in this case, the extraction of an included third molar. Until now, to reduce anxiety, the most used methods were the use of anxiolytics and sedation through inhalation of anesthesia or intravenous anesthesia. But it is already well known that these drugs can cause side effects or may be contraindicated in some situations. Another thing to keep in mind is the decrease in consciousness that this causes, increasing the risk of accidental expiration. That is why we need a new method that can reduce the uncontrolled dental anxiety but without causing side effects. Some studies have already described the role of virtual reality in relieving anxiety and fear, and as we have seen previously, the results of the study have confirmed this fact. This satisfactory result is evidenced subjectively with the questionnaires and scales made to the patients and objectively by measuring the variability of the heart rate of the patients. In this way, the heart rate variability results show how initially the majority of patients are in an excitatory state with the sympathetic nervous system more activated, and that while they undergo the surgical procedure with virtual reality, the parasympathetic nervous system increases its action, where it's understood that the patient is reaching a stable mental state. This study, but has certain limitations. On the one hand, it has not been studied yet which images are better to project. What is known is that presentations with a lot of movement can produce symptoms similar to motion sickness. It should also be borne in mind that these studies have a limited population and therefore more studies are necessary to obtain more data. Otherwise, no evidence was found in the study that virtual reality is effective in reducing pain. That's why it is still needed to continue studying it. Lastly, it would also be necessary to reduce the thickness of the screen of virtual reality devices because their large size hinders the treatment. To finish, after reading the main article and other related articles, we can conclude that virtual reality is useful to reduce dental anxiety levels. In all articles, 100% of participants recommend the use of virtual reality. For example, we can compare the results with another similar article where 50 patients underwent a dental extraction. In this other article, the results are the same, concluding that all patients recommend the use of virtual reality. But this article does not consider that there are other dental procedures that can also cause a lot of anxiety for patients, like in the case of the local anesthesia. In the study, Role of Virtual Reality in Pain Perception of Patients Following the Administration of Local Anesthesia, this fact is studied, and the results are that the group to which virtual reality is projected presents a reduction of the pulse and an increase in the saturation of oxygen, which again shows us that it is effective. To finish, we wanted to know if the results could also be applied to children. We found 2 articles in which is studied how virtual reality affects children anxiety. The results were that virtual reality was useful in reducing anxiety and pain during dental treatment in children. To finish the presentation, we can confirm that virtual reality is a useful tool in the control of dental anxiety, and it would be a good idea to incorporate it in all dental cabinets to check its benefits. We have seen that a technological improvement is still necessary to be able to adapt the use of virtual reality to all types of dental treatment without hindering the professional and his team. Further studies are also needed to determine which images are the most beneficial in calming anxiety and adapting to all patients. We conclude, therefore, that although there is still a long way to go, little by little we open ourselves to new non-invasive methods to make life easier for our patients and ourselves.